Hi, this is Dr. Fab Mancini, and I'm so excited because we're going to be talking today about one of the greatest technologies that has hit the chiropractic profession, and that is P-Motion. And for that, I'm bringing Dr. Pascal. It's so great to see you again.
Hi, Fabrizio.
You know, you and I mean, you've been in chiropractic all your life. We met many years ago when I was a student at Parker. We've known each other for over 30 years. And when you called me and you started telling me that you were working on a new technology that primarily is being used at this time for the most elite athletes in the world, for personal injury to be able to document properly the injury of an individual and get him better and back to work, or perhaps somebody that is going through a workman's compensation injury. Many times, these entities are requiring documentation to be able to show progress. So this technology that you have, I've been amazed because some of my most successful athletes, professional athletes, have been so amazed by it. But tell me a little bit about what was it that you were wanting to create with P-Motion in order to bring more value to chiropractic, but more importantly, be able to solve many of the soft tissue issues that we in chiropractic many times have a hard time documented and even more solving.
Yes. So I'm just going to explain what P-Motion is exactly, and then I'll get into that. So P-Motion is a health tech. It's a digital diagnostic tool that assesses the kinetic chains of our patients. So it predicts the areas of weaknesses throughout the kinetic chains, predicting the risk of injuries before they happen, and those that are already injured, figures out the specific muscles throughout the kinetic chains that are affected, and gives out a specific corrective exercise program so that we bring that patient back to health faster. So P-Motion, we've gained a lot of credibility, like you said, over the past 8 years with the professional sports teams, where over this 8-year span, we helped them win 22 championships by keeping their key players healthy and in the game, and those players that get injured back into the game faster. So P-Motion has been proven to work. With P-Motion, what we're wanting to do is now offer it to the chiropractic profession so that we help the profession and the chiropractors establish themselves as MSK experts. So MSK, we all know MSK injury, $250 billion market. So with P-Motion, we are confident that we will bring chiropractors one step closer to establishing ourselves as the MSK expert.
Well, you know, I love that because I believe that in our profession, the credibility sometimes has suffered because of many things that we have seen over the years. And any time that we have technology that can properly assess and be able to measure the results that we have with our patients, it only makes us look better in front of the people that, whether it's an owner of a professional team or a professional athlete, an insurance company, a third party, a company that is trying to decide whether they're going to reimburse us or not. So tell me a little bit about, and maybe you can even show me, what does this look like so I can get a better idea. And I know that everybody that is here listening and watching this is going to get invited to a very special webinar that you're going to be having to go deeper into this, but also be able to answer any questions that people have.
Yes. Your phone, your iPhone becomes a digital goniometer, calculating the different angles. 35 degrees. And then once you've done 30 different specific areas of captures throughout the kinetic chains, they are then sent to the portal. So we build a portal for the chiropractors. They have this portal where they see the assessments. So you can see that there are 30 different data points. Okay, so these data points are the areas throughout the kinetic chains that are assessed. These data points then run through an algorithm. Okay, so the algorithm then shows a diagram of the areas of weaknesses throughout the kinetics of the patient. So you can see the reds are the areas that are prone to injury, high risk of injury, or are already injured. So it kind of gives a voice to your patient. When our patient tells us, okay, I'm hurting somewhere around here, my shoulder, this patient in particular had shoulder pain. So it shows us exactly what muscle is at play, which one is affected, okay, which one is injured. It also gives you the injury risks. So what are the signs and symptoms a patient can suffer from these areas of weakness throughout their chain, okay? So you see here the impingement syndrome, which she had with capsulitis. So we then gave out a specific treatment plan, reassessed after 6 weeks, and then you can see that the reds have turned to yellow. And then another 6 weeks later, the problem of her shoulder, and this was a chronic pain. She had been with this chronic pain for the past 5 years and could not find a solution. With P-Motion, we were able to bring her back to her health goals. So we also have the compliancy. You can see the compliancy here. If you click on it, you can see that she was compliant for the 60%. 60% is considered as good compliancy, okay? So at this point, she was compliant and she got the results, but because she was performing her exercises. So P-Motion not only shows necessity for care, it also gives the patient the necessity, or we can see that they are doing their exercise program so that we can filter and keep them into their treatment plan so we get optimal health results, right? So P-Motion, what it does, Fab, for a chiropractor, it enhances the diagnostic capabilities, right? It improves also care outcome, patient care outcome. It also improves your practice numbers. By keeping retention, you can have a higher rate of retention because you're establishing shorter milestones. Every 6 weeks, you're assessing your patients and showing them need for care because they can see visually their progression, their results. And also, it offers a ongoing update and validates, like I said, the need for care.
Well, so as somebody that just received or start using P-Motion, I have now a new tool that can help me evaluate my patient a little deeper than what I'm used to, help me identify the key critical areas of concern, but then it gives me the protocol, right? It gives me the exercises that that patient will do. Not only does it give it to me and the patient, but it also tracks when the patient does it to allow me to know the compliance of that patient. And that to me is a big one because many times I have had patients that I knew they weren't doing the exercises because I saw no change, but they were blaming me for not getting better. So this way we can actually show compliance, and the compliance I think is a wonderful tool. But what I also like is the fact that it can easily not only show a patient the progress, but also any third party whether it's workers' compensation, personal injury, a governmental agency like Medicare that is trying to reimburse us, many times they question, why is he still seeing the doctor of chiropractic? And this will give us another tool to just be able to show them that this patient is improving, but it's gonna, it's taking a little longer. So tell me a little bit about the webinar that we're having. And I know that you set up some time, and I'm going to put the link here for everybody to sign up. What do you plan to cover on the webinar for everybody that signs up?
So on the webinar, we're going to go a little bit further on navigating through the program, so that the chiropractors understand a little more, sees the different exercise programs that are built through the algorithm, which is without any effort from the chiropractor. The algorithm builds the specific corrective exercise program according to the data set of the patient. So we're going to show a little more about that. We're going to also talk about exactly what P-Motion can do for them in their practice. And if they're interested, and let's not forget, Fab, at this point, we're offering for the next 30 chiropractors. It's a special limited release at this point, where chiropractors will have a low onboarding fee. We will build their orgs. We will train them so that they know how to assess their patients, so that they're ready to start this technology the following day in their chiropractic practices.
Well, if you're watching right now and this is something that you feel can help you become a better chiropractor, be able to evaluate your patient more effectively, be able to have a protocol that's already been proven and an algorithm that works in some of the biggest names in sports and others, and then be able to properly document the progress of that patient while still evaluating their compliance. So if you're interested in that, click on the link right here, attend the webinar. And if it's something that you feel maybe you'll be one of the first 30, I know there's going to be a lot more than 30 people that are going to be in this webinar, but it will be something that maybe that's something you want to integrate into your practice right away. All I can tell you is that I've been watching the evolvement over the last couple of years of this, and the results that I've seen have really left me impressed. And that's the reason that I wanted to, and I called Dr. Pascal and I said, can I please interview you? I know I have some people that would love to learn a little bit more about what you're doing. So thank you for creating this webinar. Click right here, sign up for it. They'll send you all the information. And more importantly, make sure that you have an opportunity to ask questions directly to Dr. Pascal. And that's very important because you'll have an opportunity to really experience it firsthand, but also be able to get any questions that you may have answered directly. So thank you, Dr. Pascal. Any last minute words?
It was a pleasure. Always a pleasure doing business with you, my friend.
Well, thank you. Thanks, everybody. Make sure you click on the link right now. I know you're going to be happy that you did. See you soon.